So now I'm going to get into a little bit of the data, and I hope that this part will be also really helpful. We will also provide copies of this particular slide deck so that you can refer to this data. The majority of this data presented on health disparities is coming from KFF. And first, I want to start off with talking about the U.S. population. The first video was produced in, I think, 2021. This data is from 2022. According to their statistics, the United States continues to be about a majority white country, and that Hispanics constitute about 19% of the population, blacks about 12%, Asians about 6%, American Indian and Alaska Natives about 0.5%. All right. It is very important that we start off this conversation understanding that the majority of people of color in this country really are the majority. The minority. And when we look at the health disparities in terms of overwhelmingly how Hispanics, Black, First Nation individuals are overwhelmingly burdened with sickness of disease, it makes this particular slide make a little sense in terms of the disproportionate burden that those communities have on particular disease burdens. This is life expectancy. In the first video, there was a discussion in terms of blacks and browns having lower life expectancy, and during the pandemic, actually, that we lost a full year of life expectancy. So at the very top are whites, then Hispanic, Black, Asian, and American Indian and Native Alaskans. And so you can see here that compared to their white counterparts, how low life expectancy is according to race and ethnicity. So KFF, by the way, is the leading health policy organization in the United States. I wanted to show you that the average number of years life remaining at age 65 is substantially lower for Black adults than for whites or Hispanics. Interestingly enough, in this particular data, they show that compared to Hispanics are doing far better than African Americans. And this is something that I would really love to try to figure out in terms of what particular buffers are in place to help our Hispanics. So as we can see here, that Blacks have 18% less, Black men less in terms of life expectancy, and Black female are the lowest. In terms of health and healthcare among people of color compared to white counterparts, this is a number of measures which, in terms of certain groups, fare worse or the same or better compared to their white counterparts. So the orange is worse. No difference is the light blue, and the dark blue is better. And so as you can see from Black, Hispanic, that they are, the perception is that there is worse health care when you compare it to their white counterparts. 48% for Blacks, 38% for Hispanics, 13% for Asians, 45% for American Indian and Alaska Natives, and Native Hawaiian and Pacific Islanders, 24%. So health disparities pandemic. It is a pandemic. It has been going on for a very, very long time. And in this slide, what I want to do is I want to give you a broad view of sort of what these disparities look like. And remember, it is a difference, a huge difference that can be preventable in terms of disease burden. So among Black Americans, 30% are more likely to die from cardiovascular disease. Black Americans are twice as likely to die as an infant compared to their white counterparts. Black Americans are twice as more likely to die from asthma, 3 times more likely to develop ESRD, twice as more likely to die from prostate cancer, and 2 times more likely to die from cervical cancer, and 3 times more likely to die during pregnancy. The maternal health disparities among Black women is a leading national crisis. Among Latinx or Hispanic and Latino Americans, they are 40% more likely to die from CVA, twice more likely to die from liver disease or liver cancer, twice more likely to die from asthma, about 2 times more likely to have diabetes, almost 3 times more likely, almost 3 more times likely to die from HIV and AIDS. This slide is representing sort of disparities according to diabetes, and this is age-adjusted death rates per 100,000 for specifically diabetes by race and ethnicity. And so here visually you can see that compared to white counterparts, which is about 21.3%, compared to Blacks, almost 43%, Asian, American Indian, and Alaskan Natives, about 48%, and also for our Pacific Islanders, almost 50%. This is large compared to, for example, whites and Asians, and then Hispanics are the third lowest. Now, looking at heart disease, we see that this number actually among white Americans increases because honestly, heart disease is affecting everybody and has a lot to do with American lifestyle. But here you see that sort of there are still significantly high burden of heart disease among Blacks and Pacific Islanders and First Nation people as well as whites. For all cancers, here again we see the burden is also high for Blacks, higher than their white counterparts. But it is really interesting to see also how some of the other ethnic group or racial and ethnic groups have a little bit lower burden compared to our white counterparts. And these are things that we need to figure out in terms of what potential buffers, resources, et cetera, might be helping some of these communities in terms of reducing cancer mortality. Now, at the very beginning, and I know that we are in 2025 and that we are really not thinking about COVID anymore, but as the first video highlighted, the pandemic really highlighted racial and ethnic disparities in the United States, which unfortunately are going to continue to get worse. It's really important that we look at that historical moment, especially with changes in healthcare, Medicaid and Medicare that are coming, and how this is going to continue to impact and exacerbate health disparities. So the COVID pandemic irrefutably revealed evidence of health disparities, especially among older adults, according to racial and ethnic and immigrant populations. By June 2020, the CDC reported that Black and Hispanics and Latinos accounted for 22 and 34% of all COVID cases, respectively, and despite being only 12 to 13 and 8 or 18 and 19% of the populations. Okay. These data are, of course, imperfect because of underreporting due to race and ethnicity during the pandemic, but this is really large. This is a slide also provided from the Journal of American Heart Association talking about underlying conditions that put both Blacks and Hispanics at higher risk for severe COVID. And as we can see here in terms of diabetes, hypertension, obesity, and heart failure, how disproportionately these numbers are higher among Blacks and Hispanics and also Asians and others. So disparities with COVID. Here in New York City, which was the first epicenter in the pandemic, those disparities were overwhelming. In New York City, Black and Hispanics accounted for 77% of all non-fatal hospitalization and 90% of COVID mortalities. Now that's in comparison with 22 and 34% in the nation. Just here in New York City, the disparities were overwhelming. New York City COVID disparities were driven by unequal infection risk, disparities in high-risk health factors, including social determinants of health, such as poverty, high-risk unemployment type, communication inequalities, crowded housing, and housing instability.